The case of a 17-year-old with abdominal pain and a positive serum ELISA test for H. pylori infection is presented.
So Dr. Heyman, I've just seen Peter and his mom. He was referred here from his family practitioner for some history of epigastric pain.
Okay.
Seems like he's had it about 3 times a week. It's sort of right in the middle of his belly. Doesn't have any symptoms of reflux that I can really ascertain.
Okay,
It does sound like it gets better when he eats maybe a little bit of food, some like bland things like saltines, and also when he takes Tums or other antacids. So basically what his family practitioner did was did this H. pylori test, serum ELISA, and he wanted us to see sort of what we should do for management from this point out.
Sure. So this is a really common thing that comes up with children and H. pylori and abdominal pain and ulcers. There actually was a fairly recent paper in the archives. If you want to try to look that up and we can talk about it.
Okay, great. I'll go check it out on the computer.
Dr. Heyman has an evidence-based medicine question in mind about the H. pylori serum ELISA test that Peter had. She has asked Dr. Craig to find the paper that may answer her question.
The paper Dr. Craig found in Archives of Pediatric and Adolescent Medicine is on our Data and Abstract page. To get a PDF of the article, search for the PMID on PubMed. The team is questioning whether or not to treat Peter based on his positive H. pylori serum ELISA test or do further testing. This paper looked at the same issue. 250 pediatric patients with abdominal pain underwent EGD with biopsy for H. pylori. This is a pretty invasive way of making the diagnosis of H. pylori. The authors evaluated a group of non-invasive tests for the presence of H. pylori. Prior to the EGD, all patients in the study underwent a series of non-invasive tests, the results of which were not known to the team that did the EGD. The results of the biopsy, the gold standard for the presence of H. pylori, were used to separate the 250 patients into cases and controls. As you can see, there were 93 cases with positive H. pylori cultures and 157 controls who had negative cultures. Following this classification of the patients, the authors looked at the results of the non-invasive tests. Several tests were evaluated. The test Peter had is the serum ELISA test, and we'll use that data as we guide you through the use of our web app. By the time we get to using our web app, we have already determined that the study is a valid one. That is, it has a good gold standard, appropriate controls, and a sufficient sample size. So we start by using the DX calculator to look at the clinical importance of the data. Using the data in the table for the serum ELISA, we enter the correct numbers for the cells A, B, C, and D in the 2x2 table and press the Calculate button. This returns the numbers for the test sensitivity, specificity, false positive rate, and likelihood ratio. Copy the clinical parameters to your clipboard, then paste them into the CAT document. You just need to fill in the title and citation for the paper and provide pertinent information about the study patients, including why the controls were appropriate, in this case, because cases and controls had abdominal pain sufficient to warrant a pretty invasive test, the EGD. Indicate the gold standard, then write your bottom line about the serum ELISA test, which might be something like, the serum ELISA for H. pylori is not very helpful in making the diagnosis of H. pylori in pediatric patients. Finally, press the Fast CAT button, which returns a completed CAT for you to copy and paste into email or notes. So now that you have seen one, try to do one using this same paper and the data for the H. pylori fecal antigen test. The data are found on the Data and Abstract page.